Hello everyone. Welcome to Indian Youth Development Skill IYDS India. I'm going to talk about COVID-19, the novel coronavirus. By the end of this presentation, you should be able to learn how viruses emerge, what is the coronaviruses are, who is most at risk from getting infected with coronavirus, and how to protect yourself. So, in December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting on working in a seafood and live animal market in Wuhan, China. Investigations found the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. So what is coronavirus? Coronavirus are a large group of viruses that consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that is how these viruses get their name. This is the full form of COVID-19. CO stands for corona, VI for virus, D for disease, 19 the year it was first identified. Now, where do coronaviruses come from? There are different types of coronaviruses that cause illness in animals and humans. In humans, coronavirus can cause respiratory infections ranging from the common cold to more severe disease. These include the severe acute respiratory syndromes coronavirus, first identified in China in 2003. The Middle East respiratory syndrome coronavirus, the first was identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19, was first reported in December 2019. Where the coronavirus come from? It is known that the coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animal to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not yet known. How does the disease spread? Coronavirus transmission. The disease can be spread from person to person through droplets when an infected person releases those droplets through coughing, talking, sneezing. For example, when close to another person, it can also spread when infected droplets land on objects and when another person touches them and then touches their eyes, nose, or mouth. Now, what are the symptoms of coronaviruses? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on an average 5 to 6 days, but can range from 1 to 14 days. There can be range of symptoms from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, respiratory syndrome such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. Now, 80% cases recover from the disease without needing special treatment, but there are some people who are at risk of serious illness. They include older people or people with underlying medical problems such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. Now, how can we tell whether someone is infected? The infection is commonly diagnosed by a test called a reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There is also a blood test that can check for antibodies against the virus, which may show that someone was infected in past. Now, how is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigations. Now, so how do we prevent transmission of the virus? There are numbers of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with flexed elbow tissue and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub. Maintaining at least 1 meter distance from people and the appropriate use of masks and personal protective equipment, especially in health settings. It is important to stay home if you are feeling unwell and to call a hotline on your medical professional. If you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It is important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and scientists around the world are working hard to make this happen. That's the quick look at this emerging infectious disease. Well, thank you very much for your attention. Give valuable comments and appreciate all the tutors' efforts, and the participants also follow the news, avoid spreading rumors, always check the source you are getting from the information from, and don't spread rumors. Be safe at home, take care, have a good day.